Yeah, for those of you that are joining in with us for the first time, welcome to the EPICompliance webinar sessions. I'm joined here by my co-host, Mr. Jose Delgado Jr. Has 20 years experience in healthcare consulting, currently owns and operates a mental telehealth clinic. And we're also joined by our CEO of EPICompliance, Dr. Jose Delgado. As he mentioned, um, almost almost 2 decades of or over 2 decades of experience in healthcare consulting,
It's
hospital
three now. Ray,
three.
it's three
Or,
this year. Well,
or if you
three.
count the
Well,
military,
we moved to St. Johns County in '95, and
right?
that's when you started. That's when you started Taino Consultants.
That's right. Yeah.
Well, it's safe to
Very.
say Dr. Delgado is just a ton of experience. I appreciate to share the stage with you and get your insights. And obviously, Dr. Delgado, appreciate your service as well. Used to be a former Air Force officer, and well, that's a whole nother story there in terms of what you were doing, what you were
Yep.
doing with them and the Star Wars. We'll do that. We'll have to talk about that specifically on another session. But yeah, today's subject matter is we're going to be talking about OSHA audits in healthcare, what's changing in 2025. As I mentioned, we're getting a lot of customers that are reaching out to us in various states that are getting inspected by OSHA. So really, Dr. Delgado, I just want to start and just see, what's going on. Is there it seems to be a trend.
Well, as a matter of fact, I was doing a research. There are two things happening. One, I think, have more of an impact than the other. Okay. Number one, OSHA actually this year they decided to do more inspections. The reason why OSHA doesn't normally do that many inspections is because they don't have the funds. So without the money, you cannot move forward. But doing inspections actually generates money because of the fines. So when you look at it, okay, that could be part of it. But I believe that a lot of this actually comes from another, I would say, significant event, which is the anxiety and stress in the healthcare environment. So employees are, so I'm sorry, employees are concerned and they complain. And the way, and it may not have anything to do with the job, but they have to bend some way, somehow. So the conditions, the anxiety, the insecurities, they express as a complaint, and they know they can go to OSHA, which is actually good news because OSHA fines are a lot less than HIPAA. So I prefer that they don't complain, but if they're going to complain, let them go the OSHA route because it's easier for us to actually kill it on the spot saying, no, that's not correct. No, this is the corrective action plan, and tell OSHA to go bye-bye. But I believe that is more behavioral related than actual government related. Jose?
I saw what you're talking about in regards to the mental health piece, that they're considering that as a part of the safety that employees need to have. Um, as an impartial person running a group, it's ridiculous that I gotta add one more thing. One more thing. And then because everyone is so different, I gotta be concerned about their mental health. And I just sit here like, I just want you to do your job. You know what I mean? Like, I just want you to do your job. Like, hey, you've got a ton of stuff. I've got a ton of stuff. We have a ton of stuff together. Cool. Let's go. Let's be professionals and just get our job done. But the mental health component is something that I saw as well. I saw that they were increasing their fines, which was something that they wanted to, I guess, highlight with a few more audits, so that way they can get a little bit more. The fine increase hasn't been that much. They called it an inflation increase. So your basic fine went from 16,131 to 16,550 per violation.
Mhm.
So you could get into quite a bit of trouble if you're a little bit loosey goosey. And then since COVID-19 and the PPEs and all that stuff, I know that OSHA's been doing quite a few more audits and a little bit more stringent in that respect since COVID occurred. So for us in healthcare, it's just something to where we just need to be better about documenting, because I feel that OSHA's the easiest alphabet agency to comply with.
Well, believe it or not, what I see is in healthcare is a lot of the things are COVID related and they want more requirement because of the respiratory. But in the dental, actually, I see more issues from the standpoint of OSHA than in the healthcare because they deal more with radiation. They deal more with different when they are dealing with the different pieces for the mouth, the different metals, and how they actually work with that. The respiratory when they are actually working on somebody's mouth and other things. I mean, all the drilling and all of that. So if I were to look at it from the standpoint of being objective across the board, I see more from that, more of a risk of actually committing OSHA violations in dental, also because of the documentation.
Yeah.
Then in healthcare, I would say with chiropractor, physical therapy, mental health, there's not really that much that I would be concerned about OSHA per se. I mean, there are the basics about the safety hazards, blood-borne pathogens. Most of the time don't affect really chiropractors, physical therapists, or mental health, but they
If
do
you're
affect them.
you're not invasive. It's kind of
Exactly.
nice.
Exactly. So what we gotta look at is, okay, there is a trend. Where is the trend coming from? What are the key things that we need to do? And then go from there. The fact that we are seeing an increase is only because we are a resource to our clients. They have a problem, contact us. We tell you where to find the policy, where to find the training, or what to do and how to do it. Because that's what we're here for, to be there. I'm just finishing, and Ray, don't kill me about this thing, but I'm finishing the whole revamp of the OSHA module with new policies, new forms, and even more of the tasking, monthly tasking that need to be done. But I'm doing it sectional, meaning that if this doesn't apply to you, you can skip it. Doesn't apply to you, you can skip it. Because OSHA applies to everybody in the workspace in the United States, period. I don't care who you are, OSHA applies. What people don't know is that OSHA basically says, even if you just finish school and you cover OSHA in school, you still have to train all new employees within 10 days from the start date. Because what they are saying is the school basically covers something that is general in nature. But each workplace have their own safety hazards that you need to cover right there. And that's why I say within the first 10 days, because what good it is to do it a year, 2 years later from when they started. They already got into an accident or they learned, hopefully. Okay. So they say,
So,
you gotta prevent that.
Ray, real quick though,
Sure.
what are the ones that lately people have been asking for specific things when they've been getting audited? There's three or four things that you are always getting contacted about. And I
Yeah.
know it because you're always sending us emails about it, but I just can't recall them off the top of my head. I know
Well,
one is
I was gonna
disaster
say,
preparedness.
yeah. So I was going to
One,
say to Dr. Delgado's point, it seems like the dental industry that's the majority of the customers that are going through these OSHA inspections happen to be in the dental industry. But yeah, inadequate training sessions and incident reports was one of them. Disaster preparedness, biomedical waste operation plan,
okay,
and the third one was I think it was improper handling of contaminated instruments.
Right.
okay.
Um, but I mean the main thing was and obviously I know we're going to be doing a webinar session in the future, but about the biomedical waste. That seems to be a very common thing that they're looking for, a biomedical waste operation plan. Um,
You'd be amazed by how many people just throw their biomedical waste in regular trash. You would be
I
absolutely
know.
amazed. It's,
Well, but
it's
let me actually share something with you because this is actually coming from the federal government. And
Yeah.
this is one of the things that are triggering some of these audits. Um, and I will not get into details of what it is, but the one thing that is happening, is number one, disasters. We're seeing the complexity of this disaster or the magnitude of them to be exponentially greater than 10, 20 years ago. Number two, workplace violence.
Yeah.
I'm seeing that just about everywhere. The thing is that it's not just an OSHA case, it's now a legal case. And I'm actually working on 3 of those cases about workplace violence or unsafe work environment. This is bad. Uh, Number 3 was, so I had those two. The all hazards plan. I mean,
Yeah.
this kills me because I have one facility that they inspected in December, close to the end of the year. And they say, nope, doesn't meet the requirement based on all these OSHA violations. So they told the owner within 10 days, you have to correct all of this and give us not only the corrective action plan, but also the training and the policies. Everything has to be done. And among that, one of the requirements is the all hazards. Well, all hazards means that even if your facility is in a place that there are certain hazards you're not going to see, or if you see it, start praying to dear God what's happening. Uh, you still need to address though and say there's little chance or no chance of this thing happening. When you put
Sure.
the letter in anything that is legal, you never go to final. You say may not. It have more of an incident. But in this case, when they say all, they screwed this facility. So it was, and I'm going to say a little more, it was in Puerto Rico, and I have to address blizzard conditions. And that's why I say, if I see a blizzard in Puerto Rico,
We have a
I
bigger
will
problem.
be on my knees praying to the Lord.
Yeah.
Yeah, we got
Because
bigger
the work
problems.
is over. But now you gotta look at it that, and again, people don't relate certain things that are happening today's day and age with this OSHA violation, with this inspection, with these problems. I mean, even one of the things about the crime. I have one office that one of the employees basically reported an unsafe work environment. But it was because one of the other employees was the girlfriend of a criminal, and the people that wanted to kill that guy were parking in front of the
Oh,
office waiting to
Jesus.
catch him. So yes, she was right. It was an unsafe work environment. And how many times do you see, and actually it's a lot more common that you will say that about somebody being killed in the hospital because they were not happy with the outcome, about somebody beating up a doctor or a nurse. All of that
Yeah.
is happening. So what is that happening? It's all you got to look at politics and money from the standpoint. It's bringing in negative attention to the healthcare environment. It goes back to mental health. The stability of the day-to-day person also is not there because of the anxiety, that is stress that we all have right now. So how do we deal with that? And then from the standpoint of OSHA, which is pretty much in terms of compliance, what the government requires is that you have policies that address all of these situations, training for your employees to do what they need to do, and to make sure that the documentation is there. Like I remember a couple of years back when I was looking at the policy about an armed intruder in the workplace. What do you do? And it's even to the point of telling people, and I had to document it, do not engage. Find a safe place and barricade. But the number one thing is get out. Let
Yeah.
them take the place, you
Right.
get out. So it goes back to that little diagram that everybody's supposed to have about the exit in case of
The
fire.
fire exits.
Yeah, it's no longer just about fire. It's about this thing because those are actually coming to the attention. It's more so that I don't remember seeing an audit because there was a bloodborne contamination.
Pathogen issue.
Yeah, I don't see those, but I
No,
do
that was 15
see.
years ago. That was
Yeah.
15 years ago that
Yeah,
was heavy.
but I do see people complain and say, listen, my manager, I have never been trained on OSHA. Oh, listen, my manager, they're telling me to do this procedure, and I haven't been trained on that. I don't know where the policy is. Listen, my manager is having me use this machine. I don't know how to use it. They just basically sat down with me half an hour ago and told me to use it. How do I use? I mean, lasers right now, you find lasers just about everywhere.
Yeah.
What do you do with that? What do you do? We have radiation devices. We're so much into technology that that is actually something that is easy to complain about it. And again, you get mad at your manager. Oh boy, that person, one of the first things that they think is to report you some way or fashion. And Jose knows about this thing where I was in a management meeting and somebody started getting up and saying that they were going to sue everybody. Well, we actually see that all the time, that people want to sue when there's no reason. But the thing is
Yeah.
that most of the time there's no validity. You have to show damages. You have to show proof that there are damages in order to sue. You have to show that the individual didn't follow the law. And even when they didn't follow the law, if they followed the intent of the law, I have worked in cases that they follow the intent of the law, so nothing happens.
Yeah.
But the problem is knowing how to document. If
Mhm.
you don't have it documented properly, you're done. It's pretty much open your checkbooks. And again, like I
Yeah.
say, OSHA, eh, I've seen some of the fines is mostly up to $50,000. And $50,000 for some people is a lot, but in the healthcare industry, $50,000 is pennies on it. So I'm not concerned, but I am concerned about what happens after. It's not the fine. It's that now OSHA, because you had a violation, they're going to come in to inspect you every
Every
year.
year.
I have one client that they found a
The
little
target.
sin off, and then for the next 6 years, OSHA was there every year. And then in addition to that, they want to make sure that the policies are done almost dated. They want to make sure that the training is done. And they may even ask that you bring a third party to make sure that everything is done. Man, when you really are looking at all of that, you really, that $50,000 all of a sudden becomes a quarter of a million, just like nothing. So what do we need to do? And this actually goes with multiple things. And I go back to, and this is actually something that is being done in the hospital systems right now. There are, and this is kind of cute, they are putting suggestions boxes
Oh
everywhere
yeah.
so that if you have a complaint, put it over here, let us handle it. Because it's better for them to have employees report to them, even if it's anonymous, than having employees looking for ways that they can report you. That
What's the
whistleblower,
perception of handling it rather than actually handling it?
true.
Let's be honest.
Yeah, yes, it is true. But you gotta look at it that way. Is you gotta look at it also from the standpoint, like I said before, from the standpoint of I'm the federal government. I don't want any static from the standpoint of OSHA that I didn't do something.
Yeah.
So if somebody reports, I apologize for that. Okay, so if somebody reports something, I want to make sure that I handle it right away. So it goes back to, okay, but what are the things? So like you say, PPE, there's no excuse not to have that. So disarm them before they happen.
Yeah.
Training, it may be the same training every year. Make sure you do it, disarm them. Take the possibilities. I'm sorry, I'm trying to kill this phone.
Well,
So,
let me
let me
jump
put
in
this
with
in my
that with something with that training piece because one thing I like to do, I am allergic to meetings. I don't like meetings. Meetings for meeting's sake, it's just awful, right? So I try to really get to the point and move on as quickly as possible. So I'll sit down with the team probably once a week or so because now there's always something in the news. And we just go over, hey, I saw this in the news. What did they do wrong? what did they do right? How do we avoid it happening here? Or can we see how, if you don't follow the rules, this can happen to us? Something like that. So
Live
we learn
scenario.
other people's mistakes.
Yeah.
And we at that same time we hit the just internal need for people to gossip and have something to talk about. But this way we kind of guide that conversation in a more compliance manner that is non-judgmental to our team. But I
I think that
document.
no, that's important. And to your point, Jose, I think at the same time when you're having these types of these types of get-togethers, these types of meetings, is kind of figuring out, are we documenting everything? Are we doing everything we're supposed to do? Because there's always something, right, that could potentially be falling
Oh,
through the cracks. I like to just wanted to allude back to one of our customers that was facing an audit. They received a letter,
yes.
from the U.S.
Yes.
Department of Labor, and it was a complaint, so it kind of makes you wonder, did it come from an employee or did it come from a patient,
It
And
doesn't matter. It's a
that
50
well,
cent that's
yeah,
gonna make them $20,000.
yeah, but it's like,
That turnaround, that ROI is wild.
yeah. But it's like it's they list it out, and again, it kind of makes you think, well, did somebody actually call and complain, or are they actually just mailing these letters out to everybody, with like the things that they want to see. Um, but this particular one, like I said, the alleged hazards were improper handling of contaminated instruments, infection prevention protocols, record keeping and training. Um, inadequate disposal systems for biohazardous waste, et cetera. Just, it's interesting.
At this point in time, though, if you are in healthcare, I don't know how you can run a compliance program without a vendor that is providing the basics for you. Because as someone who's running an office, you just don't have the time to develop policies and procedures, implement said policies, procedures, train on them, plus everything else you've got to do to run the business. You just don't have the
and
time. There isn't the
keep them
time in the
updated,
day. Yeah, there isn't the time in the day. So we've got to streamline and control the variables that we can. So I would highly recommend, if you don't have one, make sure that you have a set of policies and procedures. One of the things that you have to do no matter what every year is review them, modify things that need to be modified. There's going to always be a hit list of, hey, these are the things that the federal government is looking for every year. And they're very, very, very blatant about what's going on. Why? Because what happened in the news? So in October of this year, if there's anything big that happened in the national news from January to September of 25, what's going to happen is in 26, the alphabet agencies are going to focus on all of that. Look at the new updates for HIPAA security. Look at the updates for OSHA after COVID. All of these things are very reactive.
Okay, Jose, there was a comment that I completely agree with. Okay, when you are in that office, that clinic, that hospital, the pace is so fast that
Mhm.
when you get there, it's like you're running a marathon. There are
Oh, yeah.
different things happening, patient complaints, calls, somebody is sick, went to the hospital. I mean, it's all kind of things. By the time that the day is over, you look at your desk and you say, I haven't done anything.
I haven't done anything in my job.
Oh,
I've just been reacting
right.
to the
Fire,
chaos of the workplace.
being a
So while
firefighter.
I agree with you that what needs to be done when you make the list is easy. Train policies, at least monthly meetings, and document what you're talking about. Be proactive. Reality is most people don't have the time to even research what is the new change in this law. What are the changes in this? I mean, look at the SDA,
Yeah.
SDS. How many
Yeah.
people know what SDS is? Safety data sheets. But how many of them have been updated? And I
Yeah.
have not found one in
Yeah.
30
Not often.
years. It's not, I mean, it's hard because now I'm going
Yeah.
to be buying this cleaner. And this cleaner, okay, so I'm going to contact the manufacturer to tell me what is it, how to clean, inspect. We don't have the time. So, which again, the reason why I created EPICompliance is because of that. We don't have the time to look at this on a daily basis. So it's easier for me, and even in the money, and I will talk more about that. It's easier for me to pay a subscription. You guys have the policies, you update it. You had the forms I need to complete. When I need it, if I don't know where to find it, you tell me. You tell me what I need to document, and I can do it online and keep it in a safe place. Oh, Lord, great. Because otherwise, to just pay an OSHA compliance
Hmm.
officer, I mean, and let's do a quick search. Either one of you get into the web. How much will it be? And I bet you that
Hold
will
on.
be, depending on the organization, could be anywhere between $80,000 a year. And some people say, well, we don't have that kind of money. We're going to give it to the office manager or the nurse. Well, and even some people say, well, but those things are minor. The OSHA compliance office has to do all the things. I don't know what it is, but let them do that. I mean, I have even, oh, actually, we have been working even in cardiac labs.
All
In
right. So you asked for OSHA compliance officer salary.
yes,
I would say
In
in the
the state
80s
of
is my guess.
Florida,
80.
you're looking, the top earners are 128. The
Wow.
average is $74,000.
wow. Well, I was right in the around 80,000.
Yeah.
But the
Yeah. So
problem
you're
is,
looking, and then across the US, industry average is 81.
yeah,
But if you include benefits, you're looking at 100.
right.
Yeah.
So the problem is do we really have an OSHA problem that we have to invest that much money, or can we address this situation? Can we address the PPE? Can we address the mask? Can we address the job environment? And I'll go back to that, and it's in a way is I spend more time whenever I introduce any new element into the work area. I spend the time to research, to put all the safety places or safety scenes that I need to do about that in place. So then I forget about it. I don't have to address it anymore. But the problem is it goes back to OSHA comes in, and now let me talk to you about OSHA comes in, and like some of our clients, well, we have been notified of these infractions. Please
Mhm.
answer within the next 5 days. I have been
Yeah, it's
both
always a
sides.
short period of time. They give you 1 work week.
Yeah.
Figure it out. Stop what you're doing with everything else and send me all of
You
this
talking about the
information.
you're talking about the OSHA inspection
Yeah,
Yeah.
letters?
Well, no, it's
the
before the
50-cent
inspection.
letter.
Oh,
They'll send you a letter before the inspection to tell
I
you
see.
we have been notified of this thing. And then there's something else that I'm going to tell you. And basically, what I normally do is I bury those with paperwork. I say, oh, okay, they wanted this, this, and this. Okay, let's come up with a policy and let's make sure that I have a stack of paper, send it to them. Because when they see that, they're going to say, okay, okay, we're done. There's nothing here. Now,
Yeah.
there's another set of letters, which mostly now they are emails, but if you get it as a letter, that means these are fundraising events. We believe that you may have a violation on this, and this. If you have it, please let us know what are you doing to correct. Man, that's a bait and switch. You buy that bullet, you're gonna pay for it because even if you sell them something, they're gonna come in and inspect you because say
Yeah.
maybe they didn't. So what it is, and that's why I say I gotta go to the source. What is triggering the audits? And yes, there is an increase in audits. And second is what can I do to prevent them? And third, even more important, is what do I need to do in my work environment to make sure that I meet the regulations and the laws? That's it. Okay.
Yeah.
So with all of this, and I did something this morning for the benefit of this webinar, and I sent it to you, Jose, and you, Ray. and I'm going to be uploading it into the computer very soon, which is basically this topic. What are the exact complaints that we are seeing, the ticker? What are the issues? What do you have to do? Simple, because that's what you got to look at it as if it was a patient. Patient come in. What is the chief complaint? OSHA audits. Okay. Then let's look at what is it that we see, objective and subjective. Okay.
Right.
Then what is the plan of action? And that's basically the way I created that blog to help everybody. But it goes back to the same thing. Train, document, make sure that you update. Okay.
Okay.
Andy?
I mean, so again, if you want the TLDR, or because we're reaching that time, we're about 30 minutes in,
Yes.
make sure you have policies and procedures. Make sure that you're training on those policies and procedures and that you're documenting when you train. Outside of the annual, outside of the initial. Because if you just do the initial and the annual, you will get hosed on this.
Yes.
We do audits and practices all the time. I can tell you that we do at least 3 a month. And we're a small consulting firm. And I can tell you that every single time, line employees do not have answers to basic questions. Basic questions. Something as simple as, who is the OSHA officer? How do you not know? Where are the policies and procedures? How do you not know this? So we've got to really drill down on the basics so that way we can get into the more advanced metrics and because the more esoteric issues don't matter if the employees don't know what they're supposed to do and when they're supposed to do it. Hey, you get stabbed with an instrument that you use for work daily. Okay, where's the log where we document? That is a notorious OSHA sharps. How do we deal with this entire process? Auditors always ask that in healthcare. And if your employees don't know the basic process that matches up with your policy and procedure, you have a problem.
Yeah. You see, I go back to other things that for me as a business owner, what I'm concerned about. Well, as a business owner, I'm concerned about what are the true issues. And I'm talking above and beyond just the basic OSHA. I'm looking at disaster preparedness.
Mhm.
Okay, we are going to be flooded. We have a hurricane. What are we going to do with our patients and our employees? Sometimes I talk with people, and I remember one case that there was a hurricane coming down the path, and there was one employee in the parking lot while the hurricane was coming in, waiting for the office to open so she could go in. She never had the common sense that there's a hurricane, the car is being moved, rock back to back, and you didn't think about what to do.
Hey, she wanted to make her money. You know what? I want 100 of those employees.
Well,
Rain, hurricanes, or shine.
I'm focusing on the positive. I want a team player like that.
Well, let me throw another one. And these are actually, I'm not making this all. Doctor comes in through the back door. It was a dry season. Somebody was smoking. They started a fire on the back door. I know we're close to the facility. He comes in running past the fire extinguisher, looking for a phone to call me to find out what do I need to do. There's a fire on the back. But, well, hello. There's no common sense, period. So what are the things that and this is again going back into limited resources. As a business owner, I gotta look at it. Are the things that really have a chance of happening, regardless of the OSHA audit? What are the things that I can control? And then let me do it. Now, the part that most people don't get is that those things about the prevention in terms of case of, I would say, not so much accident, but I would say inclement weather or fire, something happening in your office, all of that is also covered under HIPAA.
Yeah.
What are you going to be doing then? If you have a flood in your office, who is the first one to come in? How is it that you're going to continue to operate? How do you contact your patients? Nobody is thinking about that. And those fines, $50,000 per incident, and an incident could be one patient record being affected by that. So that climbs up like this.
Quickly.
So I go back to, in this particular environment, I'm not so concerned about the OSHA auditors, because if they come in, again, it's experience. I know how to handle it. I know how to document. The problem that I have sometimes is that our clients decide to do it on their own, and they write a document that when I touch it, I say, you just increase your fines exponentially.
Yeah.
You're screwed now. I can save you, but it's gonna cost you a lot more. You have to add zeros now because of what you put together.
Yeah.
So these are the cases that if you don't know, ask, because the implications could be a lot worse. These are the cases where understand what is the environment. I go back to my number one threat in terms of everything in the office, and I will include all of the compliance from Medicare fraud and abuse, from HIPAA privacy security, from OSHA. It's my employees, because some of them think that they know better and they will report you. And a report means an investigation, an audit. So make sure that spend the time to train them. It may cost me per person who knows, and again, on their app, it will be cheaper, but if you do it outside, it will cost you. But it will prevent this from happening. That will cost you a lot more. But make sure that you have your document clear. How many times, Jose, have we gone anywhere and say, what are your policies and procedures?
But that's my point. Like, we can't go into the super esoteric and detailed things if the basics aren't handled, right? So, I mean, what was last year? We ran into a set of policies, right? You're gonna. I don't know if I told you about this, but it was a set of policies
Yeah.
that it still had the ring paper perforation. Like, this thing needed to be in a library, not in an active medical office. It was wild. Like, all right, so for those of you that are, I'm aging myself here. This is the kind of paper where back in the day, when it would get fed through the printer, you had to strip off the edges, and then you had to physically rip the paper from the actual roll.
This was it dusty?
Oh, it was yellow. It was yellow. Even though it was in the sleeves, and I'm just sitting here and I look at the office manager, I'm like, have you even looked at this thing? How long have you been at this office?
That's
2 years?
that's the most
2
common.
years? 3 years? Okay.
It's the most
You
common thing we
never
see.
looked at this?
Well, the one thing that most people still don't do is that they don't get it, that federal government requires that these policies and procedures will be accessible to every team
Employee.
member. If you have three offices and you have it in one office, log in the office manager, you're not compliant.
Yeah.
It's that simple. And then you have three sets, one set in every office. It's not practical because those documents should be live documents. So every time you replace, you do something, the other two are not. Or you're going to put it in one, not the other. And they're going to say, okay, we're going to compare all three sets. And they will never match.
There are also certain instances in that same scenario where you may have three offices, but they're not set up the same. They're going to have different points of contention with the policies and procedures that are going to require modification. So site A is going to have, in some respects, some different policies than site B, than site C.
Yeah, but now let me make sure that I understand what you're saying, because there's multiple things of what you're saying.
Let's make it easy. The fire escape plan is going to be different for every location. Right? Like, there's going to be certain aspects. Hey, the company may own site A, so we're in charge of everything. But site B and C may be rented, and one may be in the hospital. So you have different issues that you have to contend with that you need to address specifically for each location.
Yeah.
So
Okay.
How about
realistically,
employees?
though, guys, if you've got any questions, please let us know. We hope you got some value out of this. It seems as though just by happenstance, April is going to be the month of OSHA for us here on the podcast. Ray, what do we have coming up next week?
Yeah, so I'm glad you mentioned that. So next week we're going to sort of expound. We were talking about a little bit of disaster preparedness, obviously talking about hurricanes and fires, electrical stuff. We're going to be sort of expounding on that aspect. What every employer needs to know about disaster preparedness. That'll be next week's subject.
Okay, Ray. So
The
what I'm
different
gonna do,
liabilities of renting versus owning the location and how you deal with all that stuff as well. Go ahead.
okay, what I was gonna tell, I will post this blog no later than tomorrow morning. I will send you the link so you can
Perfect.
share with everybody because it's more to the point of exactly and like what what are the things that trigger audits, complaints, and incidents in the workplace.
Yeah.
Those are the two. Everything else, a
Right.
random audit. Like, for example, when you talk with the Department of Health and Human Services in terms of their audits, it's kind of funny because they say, we don't need to do random audits. And when you ask them, they say, why? It's because we have so many complaints that we are always busy just addressing the complaints and picking which ones are the ones that are really going to be making money. They don't say it like that, but that's basically it,
Yeah.
return on investment. Okay. So from time to time, that for them to show in as a random, no, I don't see that many random audits per se. There's always something triggering. So that, and ideally, you want to find out what it is so that it doesn't happen across different departments. And I'm
Now you
talking,
have to be
yeah,
careful with this too, because we have seen overzealous managers
yes,
find out who a whistleblower is, and now you've got a whole nother bag of tricks, right? So
yes,
you gotta be careful with this stuff, how you address it and how you train everybody so you don't have these issues.
yeah, yes, I agree. Okay, that's it for me now. If
Cool.
anybody has questions, Ray, you are the man.
I was going to say, if
Yep.
anybody has any questions, concerns, please feel free to put it in chat. And as Dr. Delgado mentioned, when he gets me the blog tomorrow, we will be, and again, this is for those that are joining in with us for the first time, you will receive an email from us with that blog and some information and key takeaways on today's session, as well as a link to register for next week's session. So just be on the lookout for that. More than likely, Dr. Delgado, if you get again, not trying to rush you, but whenever you get that to me, we'll get that correspondence sent out to everybody that attended
Yeah, I just
tomorrow
need to
afternoon.
handle a few legal letters and things. But Jose, a question for you.
Answer.
And not related to this, but it related to this thing.
Yep.
Employer groups that may have issues with stress and anxiety with the employees. I was just thinking about Panacea, telemedicine. If there's a way that they could work with you via telemedicine to take care of their employees.
It's all about how it's structured, right? Like, how can I put this? Counseling, what's the difference between counseling and coaching? Who I bill. Let's
Yes.
be honest. You know what I mean? So it's something to where if you have the need, there's a way to work it, but it's going to be a conversation on what is needed, right? Sometimes and we were talking about this last week, when it comes to that workplace stress, we're seeing it as an explosion with interactions with other employees or the patients, but in reality, it's something else. Maybe it's hey, we have very inefficient protocols for dealing with things like prior auths. And we're trying to get something done for a patient. The patient and the family is hounding us, but the insurance is holding us back with the prior auth. And the pharmacy can't fill the script because the prior auth hasn't been approved. And then, we're just playing through this. So it's something to where those policies and procedures for everything, having them nice and streamlined, really can help out the scenarios. Now, if you're having an interpersonal issue, I mean, I'm never going to say, hey, go to a boxing gym, get everybody some gloves, a helmet, a mouthpiece, and let them have at it. But you'd be shocked by how much beating the crap out of a punching bag for 30 seconds will make everybody think a little bit differently, right? So it's absolutely something where there's options. There's absolutely options. It's just what is going to fit for your team. And if you're having a lot of turnover in your office, I guarantee you it's only a very short matter of time before someone complains to an alphabet agency of some kind. You got to figure out why you're having that turnover. And if it's something that can be addressed or minimized, sometimes it's relationships with the provider, but that provider is an owner. So it's very difficult to make that issue go away. But perhaps there's a way to mitigate the exposure to the rest of the practice by finding certain personality types that work well with that problematic employee. So, but again, ask us the question. We can get more details. We can help figure out an option or an answer. And, it is always going to be trial and error. There's no perfect answer for everybody with this stuff. But if you don't do anything, you will have a problem. You're just rolling the dice to see when you get Yahtzee.
Right. Okay. Thank you, sir.
Thanks, everybody.
Yeah.
So stay out of trouble. We'll see you guys next week.
Sounds good. I appreciate everybody joining in. And if you could, please like and subscribe to our YouTube channel. This would be our 71st episode. We've been doing these since October. I know, right? It feels like yesterday. We've been doing these since October 2023. So there's plenty of content for you to recap on. Dr. Delgado is on several of those webinars as well, providing some good insights. And again, if you guys have any questions, concerns, any topics you'd like us to discuss, please feel free to reach out to us. Certainly here to assist.
Yep. Thank you.
Great.
Have a great
Thanks, guys.
Thank you so much, Dr. Delgado and Jose. You take care.
Yep. Bye, Ray.
All right. See everyone next week.